Hi, I'm Michelle Does. I am a realtor and I am here with Kristen and Chris Martin and their son Brady and the rest of their family. And we're doing an interview about a blood drive that we're doing in honor of Brady Martin.
We're Chris and Kristen Martin. We're mom and dad to Brady Martin.
Kristen and Chris, you guys have been on this journey for a while now. Can you just tell me a little bit about Brady's diagnosis and your journey so far?
June 10th, 2021, our son Brady was diagnosed with acute lymphoblastic leukemia, and he was actually designated high risk because of the extremely high level white blood count that he came in at. He was 9 years old, so that kind of started the journey for us, this cancer journey. A few weeks into his diagnosis, we actually found out that he has a very unique mutation of his leukemia, which makes him actually only the 65th documented case in the world for his particular mutation. He failed to get into remission after the first round of treatment, and that's when they consider him refractory, which is unable to be treated through a traditional chemotherapy treatment. So we moved on and we had to do some different treatments last fall to get him into remission to then move forward with the bone marrow transplant. His twin brother, Blake, was a perfect match and donated bone marrow. So Brady had a bone marrow transplant December 3rd of last year and did phenomenally.
Yeah, I mean, there was a couple times the bone marrow transplant journey was really difficult, and he almost died twice during it, but it was successful, and actually he was doing tremendously well. And once we got out of the hospital, he was kind of playing soccer and doing travel baseball in really record time and faster than anyone would have expected and things. And so we were kind of back on the pathway to normal, it seemed. Unfortunately, we found out on August 3rd that his cancer had returned, and that we had to go on, I guess, round 2 or leg 2 of the journey in the battle now. So that's kind of where we find ourselves right now.
Round 2, what is it entailing for you guys? And for Brady specifically?
Thank God that it's happening now, and that there's been as many advances as there's been in recent years. The leader in the country is Children's Hospital of Philadelphia, and so we've been accepted. Brady's been out there and gone through the beginning stages of the process and got it accepted into a trial to do the most recent, newest version of CART therapy. And so the next step for us is, once Brady's cells that they are preparing for the CART therapy and are ready, and then Brady's body is producing the things that it needs to produce, and his body's ready, we'll be going back to Philadelphia for a minimum of 5 weeks to go through that process.
And so all along the way, Brady has needed blood transfusions and platelet transfusions. You know, how many times, if you had to take a stab at it, how many bags of blood has Brady received?
I would say we're nearing 100, because there's been a couple specific surgeries that he's had to have where he's required like 10 to 20 bags just to get to the minimum levels that they need him to be safe for them to actually do the surgery or the procedure.
It means more than we can adequately express in words, I think. I mean, we've been in the hospital, we know other people, we know other patients who've had to delay treatment, who've had to delay surgeries or procedures because there is a blood shortage right now, and it's not something that there just is no substitute for people going out and generously giving of their time and their blood, to allow the advances in modern medicine to work the way that they do. So for us, it's meant more time with Brady, recovery, the ability to have procedures, the ability to have surgeries, the ability to recover from those processes and those surgeries and those procedures. So it means more than we really can express.
There's been at least 3 times, I think, where he's been on the last bag that they have in the hospital that is a match for him. And as a parent, that's a really scary place to be, knowing that there's nothing left. And then, we know of other families that were down the hall and their children weren't able to get surgeries that they needed to start the treatment for their cancer because there weren't any blood bags, available in their child's batch. And so that's just like, it's one of those things you just can't even imagine it until you're in that place. And, I've talked to people, I said, if you've ever been to a blood drive, do you ever look around at the demographic that's there? And people will pause and they'll be like, I'm like, it's normally an older generation. You don't really see the younger generation at blood drives as much. And they're like, I think you're right. And I was like, yeah, I was like, you know why that is? And so they just also sit there and they just look at me and I'm like, it's because we haven't been impacted in our generation by a story that's personal to us that, kind of convicts our hearts to like go and do something to change it. And so, that's what we're trying to do is speak to the people in our age demographic and try to like bring awareness to the shortage. We've had literally hundreds of people reach out and want to donate specifically for Brady, and we've just politely declined it because we just feel passionately that if the country as a whole steps forward and steps up to donate, then our son will also be taken care of. But that's just important to us.
The physical part didn't really hurt. It was more the mental part because I couldn't be with Blake, Aubrey, Cooper, Tanner. And so that was just pretty hard because I couldn't be with any of my family. And I felt like I was missing out because they'd have friends over and stuff. And I just felt like I was kind of missing out. It means a lot because in the hospital, they always had to make sure the blood was for a good cause because they weren't just going to give blood if someone just needed a little bit because they have limited supply.
Blake, a lot of folks are nervous about donating blood or platelets because they're afraid. And you had to do something so brave by donating your bone marrow to Brady. What advice would you give to someone that's here today or signing up to donate for this blood drive?
I will admit I was really scared of the needles, but seeing him in pain just made me feel like I needed to. And it wasn't going to be a big deal compared to what he's done.
So these are called battle pups. We started it a few months after Brady got diagnosed with cancer. These little guys, 20 different kinds, we box them up to kids and we give them to them so it can bring them joy and so they don't have to think about all the bad things they've went through.
In total, over 3,000, at least 200. Every 10 days I go in for chemo right now, and so we take 12 every time.
Thanks, Brady and the Martins, for doing this interview. We really appreciate you guys taking the time, and we are just so grateful for everybody that is willing to sign up to donate blood for this blood drive and come out and donate something so valuable to Brady and the Martins and countless other people.
Thank you so much.